Welcome to the practical rooms here at RGU. So within the physiotherapy programme, we're looking to recruit somewhere between 30 and 36 students per year. So it's a very small cohort, and within that, we very much do get to know our students, and I know all the students on first base terms. So in terms of that, it's a very friendly university for you to come to. Within the first year of the programme, about 80% of your time will be spent in a room such as this. And again, that should give you an impression of the practical application and the practical nature of this physiotherapy programme. So suffice to say, when we have 36 students on the programme, there'll be 18 students in here, which means 9 students as being models on the beds, on the plinths, and 9 students actually getting a chance to practice their assessment, treatment or management skills. And a member of staff will be able to walk around and be able to give you feedback on how well you're doing. And that's really, really useful with having that small numbers, because it allows us to be able to really consolidate that and be able to focus on developing our students' skills. Within here in the practical room, therefore, there's a big emphasis on you being able to practice on each other. And in the first year of the programme, there's a big emphasis on musculoskeletal management. So thinking about your assessment techniques, how you differentiate between muscle, ligament and joint problems. As you move into second year, we then start thinking about how would you need to adapt that assessment for neurological patients. So thinking about what you need to look at if you had a person who maybe had a stroke or somebody who has multiple sclerosis, for example. And again, thinking about how you'd need to adapt that assessment approach. Towards the end of second year, we start looking at cardiorespiratory, making sure our students can undertake a comprehensive chest assessment, but also being able to vary it for the different chest presentations. So whether they're a surgical patient or a medical patient or a patient who's in need of intensive care. So therefore, by the end of the second year, you've covered the 3 main areas of physiotherapy practice. And then as you move into the third year, we can start looking at more complex rehabilitation approaches. And that's where we start challenging our students more. So we may give them some case studies where there's a scenario where the patient has maybe broken their leg, has maybe got a head injury, and they've got a lung pathology. And then the challenge is for the students to think about problem solving their way through that. Which problem would they prioritise and why? What treatment would they use and why? And what are maybe the limitations that those multitude of conditions would have on their management? So we're very much trying to get them to think about the problem-solving approach. All the way through the programme, it's all about justification. So in year 1, we're wanting students to justify their treatments in relation to the pathology and the physiology. In year 2, we're trying to broaden their assessment skills and relate it to a broader range of conditions. And by year 3, we're looking at complexity and the research that supports those particular treatment approaches. By the time we're getting to year 4, we're looking at graduate level skills, and that's our focus in year 4, to make people practice ready and practice fit. So we're thinking about students critically evaluating the literature, critically evaluating their treatment approaches, and be able to justify using all those sources why and when they would use a particular treatment approach. Because of that practical nature of our course, underpinned by the 7 clinical placements that they have scattered throughout the course, it does mean that our students are very much geared to be ready for that clinical environment. And that's something I would associate to why we have year on year very, very high employability statistics within our programme, because people are ready and fit for the purpose that they need to be employed for. So I hope you've enjoyed this video. It gives you a little indication of what the practical rooms are like.